next topic is going to be on its violence against women. Approximately 1 in 3 women in the region report physical, intimate partner violence or sexual violence by any perpetrator during their lifetime. Violence by an intimate partner is the most common form of violence experienced by women. In addition to being a human rights violation, violence against women has long-lasting and profound consequences for women's physical and mental health, which are often overlooked and underreported. These include suicide, HIV, AIDS, STIs, maternal mortality, among many others. There are compelling reasons for a specific focus on violence against women. Here with us to speak more about it is Alessandra Ruedas, who is the advisor for intra-family violence here at the Pan American Health Organization. Welcome.
Good morning.
Morning. So Alessandra, what is violence against women and how is it different from other types of violence?
Sure. So I think that we have to start by saying that all forms of violence are unacceptable and that there is a role for the health system to play in addressing whether it's violence against children, violence against youth, etc. But there are specific characteristics that you alluded to in terms of violence against women, which really requires a different focus. So to start, violence against women is often invisible, right? Because it's not part of the national statistics. And so if you look at a country's national statistics, violence against women will not figure there as it is. However, it's linked to maternal mortality, HIV/AIDS, unwanted pregnancy, etc. The other reason is that it's a form of violence that's commonly socially acceptable. So whereas homicide, for instance, is unacceptable in any of its forms, many forms of violence are deemed to be acceptable. So how many of us have heard when a woman is raped, well, what was she wearing? Where was she going? So these types of norms that make the victim the responsible one for the violence that occurred. And that has implications in terms of women being willing to access services, whether they're legal or whether they're health services. So I think when we're talking about violence, it's really important for us to have this gender lens. Different forms of violence affect men and women differently, and that has implications for how programs can prevent and address these forms of violence.
And I mean, violence against women is traditionally been seen as a human rights issue. Why is it important for health systems to be involved as well?
Yeah, so that's a really great question, and I think the important thing for us to note is that the health system is already seeing women who are survivors of violence. We know that women who experience intimate partner violence or sexual violence, they tend to need more health services and to seek those health services. But they won't come to the health service saying, I experienced abuse and this is what I need. They'll come presenting the symptoms or the consequences of abuse and violence, whether it is recurring infectious diseases or whether it is an unwanted pregnancy, etc. And so if the health system is not prepared to identify violence, they're not going to be able to provide women with the services that they need. They won't be able to provide them with an adequate diagnosis and won't be able to help. If they are prepared to identify violence, they can intervene early, they can mitigate the negative effects of violence, and they can hopefully prevent that cycle of violence from continuing.
What can health systems do to address violence against women?
Yeah, so I think that there are many roles that the health system can take. I think the first one is to provide comprehensive services to survivors. But the health system can also help us to see this issue as a public health issue. And how do we do that? We have to gather information on the prevalence, the health consequences, the risk factors, and we also have to support prevention efforts. There are a number of new initiatives that are showing promising results in terms of preventing violence from ever taking place, and the health system has a role to play along other sectors in implementing these initiatives.
So lastly, as I said at the outset, approximately 1 in 3 women in the region are victims of this. Do we see that number changing? Is it, are there certain countries where there's a stronger focus that we need to be looking at versus?
So there's a range of prevalence across countries, but also within countries. We have countries in the Americas where 53% of women have experienced intimate partner violence, whether it's physical or sexual. So there's a wide range, usually from about 17% to 53%.
Sure.
But those country level numbers also mask differences within countries, whether they are between rural and urban settings or across socioeconomic levels. Unfortunately, we don't have trend data to allow us to know whether it's decreasing or increasing.
Sure.
We have much better data than we had a few years ago.
Sure.
And I think in the near future we'll be able to assess whether the levels are going up or down.
Great. Alessandra, thank you very much for giving us a lot of insight into this very important topic, and continued good work on this. Again, thanks for your time this morning.
Thank you so much.
Yeah.
Thank you for having me.